Hello, my name is Gillian Tagomo. I'm currently a third year pharmacy student. I'm from Olathe, Kansas. I did my pre-pharmacy at Johnson County Community College and then applied to pharmacy school at KU. And in KU, so far I've been really involved, like in addition to going to school, I've really liked being involved in organizations. Um, in addition to like being involved at school, I also work at a hospital pharmacy setting. And so having just a unique like background in pharmacy is what I've really liked about pharmacy school and exploring different areas kind of thing.
How did you decide that pharmacy was the profession that you wanted to go into?
I knew in high school, back then it was about sophomore year. I kind of was looking into different professions, what I wanted to do in college, kind of thing. And I did a lot of research online and I asked a lot of people I knew who were in the healthcare field. And based off of that, I knew a lot of pharmacists just because the people who I was connected with at the time with my family and as well, like they were in pharmacy school at the time. So I asked a lot of questions. Um, After I graduated from high school, I got a job in a pharmacy in a retail setting, and that's when I realized I really, really enjoy what they do. And that's how I continued doing like pre-pharmacy throughout college and applied. So that's definitely how I knew.
Will you describe what the pre-pharmacy curriculum and then the pharmacy school curriculum looks like?
Yeah, so the pre-pharmacy curriculum, it consisted of a lot of or general chemistry, my first year of college. Math was statistics and calculus, lots of biology as well throughout the both years of my pre-pharmacy. Um, Definitely organic chemistry as well. I was able to complete all the prerequisites um, in 2 years, but it's because I had like heavy semesters. But at Johnson County, I was really fortunate to have good professors who were able to help me and sit down with me kind of thing. But it was definitely just a lot of basic sciences in pre-pharmacy. And then transitioning into pharmacy school, it became a lot more of what I really liked. It wasn't just basic sciences was really broad. And then in pharmacy school, it got really specific to chemistry and biology. And I would say the biggest difference is that it's more specific and you kind of have to be more disciplined too in regards to like your studying because you're not going to be studying the same way for your general biology as you would for your pharmacology class kind of thing. I feel like it's more specific and you kind of have to know the whole picture kind of thing. So that's what I would say would be the big difference. It's more detailed, but because I like what I'm learning, I really enjoy the process.
Can you talk about any classes that you've had that have been a challenge to you?
In pharmacy school or in pre-pharmacy?
Both.
Both. In pre-pharmacy, um, organic chemistry was really challenging. I think it is for a lot of people. The thing I found it was almost like learning a new language because learning the structures and everything it really is, and knowing what's like hydrophilic, like the different molecules and stuff like that, and the reactions. It was like learning a new language for me. But the good thing is that background really helped in pharmacy school because when you're looking at a lot of drug molecules, you look at how like the structure and whether or not it's like more fat like or more water like. That background was really helpful. Granted, it was still challenging in pharmacy school, like biochemistry, the medicinal biochemistry classes, because it's just so in depth and you have to really put the time to study more in pharmacy school compared to undergrad. And so for me at the beginning, I struggled with that transition of we had classes in the mornings from like 9 to 12 maybe labs in the afternoon. That afternoon time is not like relaxing time. It's the time you need to study the material you learned that morning. Otherwise, it's really difficult to catch up at the end because it is really detailed in regards to the biochemistry. That's what I struggled with at the beginning. But then, like in the spring of my PE1 year, I knew what to do, started studying more so right after I learned the material so that it didn't become like a big overwhelming thing at the end. So yeah.
What about favorite classes that you've had in pharmacy school?
I have loved pharmacotherapy. Pharmacotherapy is when we learn the reason, like the clinical reasons as to why a drug is preferred over the other, the disease states like high blood pressure, high cholesterol, heart failure. That has been so fun to learn. Um, Another thing I've really enjoyed in pharmacy school, actually this year, it's in my pharmacy management classes. I've really enjoyed learning about how the business side of pharmacy. So that's something I didn't expect we would get exposure to in pharmacy school. And so lately that's been something I've enjoyed learning this like P3 year.
Can you talk us through a little bit about the experiential learning you do in pharmacy school through rotations and the team steps and things like that?
Yes. So after your first year of pharmacy school, you do a community rotation, which is in a retail setting or a community pharmacy setting. That consists of applying the knowledge you learned your P1 year. So P1 spring, we did pharmacotherapy 1, which is when we learned about mainly over-the-counter medications. And so you apply that knowledge you learned the spring before that summer, which was really rewarding too, especially if you've never worked in a retail setting before, to actually see what you're learning. And those are 4 weeks long. And that whole process, I really had a good experience just applying what I learned. Even the fact that I worked in a retail pharmacy before, it was still really beneficial for me. Um, the site where I rotated at, they let me do a lot of like counseling and even like appointments with patients, like helping them as far as like adherence with their medications. And it was also really nice being able to make recommendations about over the counter, like cough, like what type of cough are you having, which is something that before pharmacy school, I never knew, I would not know the difference between that kind of thing to like recommend the right medication. Um, so that was like after P1 year. After P2 year, you do a hospital focused rotation where you apply all the hospital pharmacy knowledge you learned during your second year, including like antibiotics. You learn that P2 year, which can be challenging at first, but it's really fun. And so you apply that knowledge into a hospital setting, and then you do like dosing in the hospital, you do recommendations based on the type of infection the patient has. So that's mainly what happened during the 4 weeks of that summer rotation after P2 year. And then during the last year of pharmacy school, during the P4 year, after actually starting this summer when I finish P3, it's going to be a whole year of rotations where I can rotate in different pharmacy sites, including hospital, including community settings, and even like industry pharmacy settings. So, which is what I'm really excited about. And like that fourth year is your year for you to explore different areas of pharmacy to really decide what you want to do, kind of thing. So I'm looking forward to that.
Good. So you've talked about how you've worked a little bit while you're
Mm-hmm.
in pharmacy school. How do you balance work and school?
Definitely just work, school, and even like being involved in organizations. It requires you to have excellent time management skills. I have like several calendars. Like at the beginning of the semester, I make a Google Doc calendar with all quizzes, all exams, all due dates. After that, I will add my work calendar like on top of like my school calendar. And so that just gives me like a big picture view of what's going on like for the next 3-4 months. And then I have another or weekly to-do list of like Monday through Friday of things I will do at different times of the day. So I don't fall back and like feel like I have to like cram or anything like that. So I have that weekly one of Monday through Friday of what I'm hoping to do. And then every day I make what I want to do, like during the day as well. And so that method has helped me a lot in regards to like things that are immediate. Like the daily ones are usually things that I need to have done by the end of the day. The weekly ones is okay, along the week, it's a little more flexible. If I don't get it done on Monday, okay, maybe Tuesday, I have like wiggle room kind of thing. Also in that schedule, I put time to relax and time to maybe, time for myself or go on a run or something like that, because it's really important to make time because you get so busy at times. But it's really rewarding to make the most of your time by following your schedule. And when I do stick to it, it feels so rewarding knowing that I didn't waste time. My whole day was well spent kind of thing. So it's definitely great time management skills. Otherwise, you will fall behind.
So talk a little bit about, you mentioned that you're involved in pharmacy school. Talk a little bit about the student organizations you're involved with and the benefits of being involved.
Yeah. So I'm involved right now, I'm actually president of the Student National Pharmaceutical Association, which I helped found or bring that organization to our school last year. That one, like, it focuses on serving the underserved. And we started, like, this year we did several projects in our community in Lawrence with um, providing pharmacy services to to the Lawrence Community Shelter, education at the Lawrence Public Library kind of thing. So that one I'm really passionate about. Through that, I've been able to um, be involved at a national level with the organization as well. I attend the conferences, and the conferences allow you to network and meet other pharmacists doing really cool things around the world, like to help people who need it the most, or around the nation, sorry. So that's one I'm really passionate about. I'm also involved in SSHP, the Student Society of Health System Pharmacists, because I do enjoy the hospital setting. And it ties along with SNAFA because one of my passions is just why the readmission process, or if patients are getting appropriate follow-up care after getting out of the hospital. So I'm involved with the hospital organization, or because of that health system interest I also have. I also am involved in American APHA, Academy of Student Pharmacists, which is just the American Pharmacists Association one. It gives like a good broad spectrum exposure to like the Pharmacy Leadership Society, which is something that I am, or you are inducted into. Your peers nominate you kind of thing, and based on your leadership. And I've really enjoyed, I've grown so much from the meetings that we attend as pharmacy or PLS members and everything. So that's another thing I do.
What advice would you have for a student that was exploring different healthcare options?
Definitely there's a lot of resources online. As far as even on YouTube, you can look at day in the life of a pharmacist, or a day in the life of a nurse, or a day in the life of, different healthcare professions. I would definitely suggest shadowing as well. For me, my shadowing was kind of like getting a job in a pharmacy. So that really helped narrow what I wanted to do. But get to know different people in the healthcare field kind of thing, to see if this is something you can see yourself doing for a long time.
Now we're going to talk a little bit about the application process. And since you've applied, KU's pharmacy application process has changed a little bit.
Yes.
But can you talk about, let's talk about first getting letters of recommendations. How do you recommend going about doing that?
You definitely want to get someone who is more than just someone, like, you have to have a relationship with a person where they can write a detailed letter about who you are as a person, not just really like just not the fact that, this person was a student in my chemistry class and attended class and that was it. You want to be, maybe if you're asking a professor who maybe you asked for help a lot, like saw you grow within a subject or kind of thing. Also, job where you work is a good place to ask for a recommendation letter because they can really speak to like your character in regards to maybe like you being on time, you helping out, keeping a positive attitude, kind of thing. So someone who definitely knows you more than the average like person and can write a good full picture recommendation on who you are.
What about the interview process? What was that like and how did you prepare for it?
Okay, so for the interview, I did mock interviews with my advisor, or mock interview with my advisor, which was really helpful. She actually made it way harder than the actual interview, which was really helpful. Um, I would say also the interview, think of it as like the fact that you're getting an interview is a really good thing because you impress them on paper. You essentially just want to impress them in person and show them who you are as a person. So don't be too naturally you're gonna be nervous for the interview, but don't let that get in the way of like you showing who you are. And definitely take deep breaths. It's really like they want you there's a reason why they asked you to come in. It's because you look good on paper. They want to meet the person who they read about, kind of thing. So that's how I like to think about it. And think of it also as a conversation. I felt like my interview, it felt more like a conversation and it goes by really, really fast. But don't be I know it's easier said than actually done, but try to relax before your interview. Have the mindset that you're here because you impress them and they just want to learn more about you.
What tips would you have for somebody that's getting ready to apply to a professional program?
I would say nothing worth having comes easy. The application process is not easy breezy. You're going to have periods of time where maybe you know someone else who got the interview and you're not sure as to, why you didn't get it kind of thing or why yours is not there yet. But if you put your best foot forward, it's going to be worth it, absolutely. So make sure everything you do to the best of your ability as far as application. And make sure you get several people to proofread. Like grammar is something that is like, it can be easily missed if you are the only one looking at your paper kind of thing. So get several people to give you an opinion on like your letter of intent. Does it truly speak to who you are and your mission and your goal for applying? um, kind of thing. Another thing I think is really beneficial is reading your letter of intent out loud. Like as you're just reading it out loud and seeing if it really sounds like you, kind of thing.
So overall, what is the best part of being a pharmacy student? What is the most challenging part?
Oh, the best part of being a pharmacy student, like I have grown so much as a person in regards to um, breaking out of my shell. That's been um, the best thing that's happened to me in pharmacy school is me just getting out of my comfort zone. At the beginning, I wanted to be involved and really be one of the people, making things happen. And so I was open to, well, first of all, you have to make sure school is in check. So make sure, you have your grades and everything, but get out of your comfort zone, maybe join a new organization, or maybe learn about something that will help you outside of pharmacy, like learning about the populations in the places that are around the school or like underserved like areas. That's something that I was interested in. Being able to talk to people, networking is so important, and that's a skill that I have developed through pharmacy. So it's the best part has been, in addition to just learning the knowledge that I've gained in the years, is just learning how to talk to people and just having those skills that are essential in like the pharmacy field. It's more than just medications. It's how you talk to your patients, because they're not going to take the medication if they're not able to communicate to you, or they feel like you're, closed off. There's so much more than just the drugs that are important in pharmacy. So that's been the best part about it. One of the most challenging has been, getting up from failure is always hard. So it's just about accepting that, there will be times where things will get hard. It's going to happen. It's about how you react to it. So maybe you did not get that grade that you felt you deserved after the exam. The professors are there to help you, like set up a meeting and, talk to the professor. What did I do wrong, kind of thing. That has been something that has helped me in those hardships. But I can really think of a lot more good than like bad times, because I feel like it helps me a lot to just have a positive mindset, because they're so helpful in regards to helping you learn it and setting up office hours, Zoom time. But just getting up from those times when you fall down, I think, can be difficult. Yeah.
So what are your plans for your future?
In the future, I really want to I'm really interested in management. And so I want to do like health system management focused residency, and really help with like large scale underserved populations. I really want to work in a hospital that maybe is in an area that could use improvement, kind of thing. And I really like starting new projects, and like I love something that can make a big impact. And it doesn't come easy, but I think in a place where I can work in a team setting to improve readmission rates, or like help with outpatient follow-up visits, kind of thing. So that's definitely the direction I want to head towards. And to get there, I plan to do a residency after I finish pharmacy school.
Will you just briefly describe that residency process and what that looks like?
Yes. So residency is 1 to 2 years after pharmacy school. And it's for most people who want to go in a hospital setting tend to do a residency. And as far as that goes, it requires you to apply again into a program that you're interested in, which is usually in different hospitals. Most or large system hospitals tend to have residencies. And so you apply for that, kind of like how you would apply for pharmacy school, in that you send over like your transcripts, your letter of recommendation, letter of intent, kind of thing. And from there, you also interview, and you go through this system called a matching process in order to match at a place for a residency.
Do you have any final thoughts that you want to share?
I would say, you guys, like the fact that you're interested in healthcare is so rewarding. I feel the people who you interact with, they really have, a lot of them really don't know a lot in regards to health, and it's amazing the impact that a pharmacist can make on a team. I've seen that firsthand, not only at work, also my rotations. And I know a lot of people who have, or a lot of even research is coming out saying that the impact of a pharmacist in a healthcare team makes, brings about amazing outcomes. And so definitely look into pharmacy if that's helping people is your passion. And if you feel like you're a people person, that helps you. But be open, keep an open mind and everything. So yeah.
Thank you so much.
You're absolutely welcome.